there are still too many bad burgers out there. So Arby's is running that Wagyu steakhouse burger back. Arby's, we have the meats.
Right now we are living with inflationary times. All of us will talk, I'm sure, about going to the grocery store and the rising cost of things. Just when you think you're kind of used to it, you'll go to buy something and you're just blown away by the expense of it. So imagine if you were somebody who really was struggling to make ends meet, and on top of that, you're expecting a baby. That's not only worrisome, it's frightening. So we're so happy this morning to have Felicia Jenkins here with us. She is the regional coordinator for WIC, part of the Hamilton County Health Department. Nice to see you.
Hi, I'm happy to be here this
morning. I think that's a fair way to put it, right? Because when you're an expectant mom, from the minute you know, all your thoughts are on that baby. And you want so much to do everything you can to protect that little child growing inside of you. Nutrition is where it starts.
That's correct. That is so correct.
So what is the WIC program exactly? It's a long-standing one.
The WIC program stands for Women, Infants, and Children. And we support women who are pregnant, women who are breastfeeding, and women who are postpartum, also infants and children under the age of 5.
Okay, so you have to meet, we won't go into the threshold, but there is an income level.
Yes, ma'am. So it's for low income individuals as well. So they do have to meet income guidelines.
Okay, so what does it look like then if somebody calls the number, and we'll share that with you in a little bit, but if they call the number, I guess they kind of consult and talk with somebody to find out if they fit the program?
That's correct. They can find out when they make that call.
And then if they do, where do you go from there? What are the steps?
Let's see, when they call in, we're going to ask them certain questions like, are you pregnant, or are you calling for your children? Because if a mom isn't pregnant, her children are still eligible for WIC. So like I said, they can still meet the income guidelines through other agencies or whatever they're going on, because they will check income. We have to have proof of identity and things like that. So there are guidelines that have to be followed. But once they call in, they'll go through a questionnaire, questions with our PSR, our public service representatives, or maybe our people who work in the phone room, and they'll find out that day.
I'm peppering you with questions, and I'm not trying to put you on the spot. So at any point, you can just say, Julie, I don't know. Tell them to go to the website. But if you are somebody and you've lost a job, if that's what's happened to you. So your income is gone, but maybe you've still got some savings. Which would you be looking at, the savings or the income?
The income.
Okay. So you just can't have, so your income has to be low. And so I would think that means call and call quickly. You don't want to be tapping into that money if you don't have to. Is that right? So when you go to the store, I think a lot of us have seen before at the grocery, it'll say WIC approved. Is that right? There are certain things that you can qualify for and other things that the card doesn't work on?
Correct. WIC is a supplemental program, so it's only going to provide so much. It's not going to provide everything that a family needs, but it will help. So it provides protein sources through like milk, peanut butter, beans, fruits and vegetables, and whole grains like cereals, breads.
Okay, so when you're purchasing those items, the card that you have, if I'm saying it right, gives you a discount on those items?
It's just certain ones. It'll let you know. They load a card with benefits, and once the benefits have loaded, each family will get a certain amount of fruits and vegetables. They get a certain amount of milk, cheese, yogurt as well, protein sources, whole grains. So.
Nikki, you and I were having a conversation. We have a couple of minutes left, but you had said that as long as a woman is breastfeeding, did you tell me that for women who might be having a difficult time, there are resources available too?
Yes, we have peer counselors that can help. If a mother's having trouble or difficulty breastfeeding, there are peer counselors that can help. Even after work, they can make phone calls and they'll try to give them direction, or they can come in. There's classes.
And it's a national program, right,
Yes.
WIC? So whether you're watching in Hamilton County or Catoosa County, I mean, this is not something unique to us. But we're going to share with you the phone number for the Hamilton County Health Department
Yes, ma'am.
version of WIC. So it's 209 8220. That's the phone number that you're going to call. You can also go to health.hamiltontn.org. There is just so much that they do there at the Hamilton County Health Department.
Yes, ma'am.
And I guess your chief aim, Felicia, is to make life more healthy for the people in the area.
And easier if we can as well.
So if you have a child under the age of 5,
Yes, ma'am.
if you are expecting a baby, call. And then if you're having a difficult time nursing, and call for that as well.
Yes, ma'am.
All right. Thank you so much.
Thank you for having me.
I appreciate it. Again, that phone number, 209-8220. We're back after this.
On the Jennifer Hudson Show. Jazz up your holiday parties with these TikTok trends. Then Sam Worthington shares his Avatar adventures. Plus Kendrick Sampson and Shalea sings for us.
Weekdays at 3 on Local